Hi, my name is Dr. Chris Tuell. I am the Clinical Director of Addiction Services at the Lindner Center of Hope in Mason, Ohio. I'd like to speak to you today about the relationship between substance use and stress. Now, as feelings of anxiety, depression, or just sheer boredom mount due to our growing pandemic, the desire to turn to drugs or alcohol as a coping mechanism could become more problematic. Experts warn against self-medicating during these stressful times for a multitude of reasons. For many people who struggle with mental illness and/or substance use disorders, there's an unfortunate tendency to withdraw or to isolate from others. So when we are told to practice social distancing, remain in our homes, isolate from one another, this can feed into a further deepening of an individual's struggles and isolation with depression, anxiety, trauma, grief, or loss. Now, according to SAMHSA, which is the Substance Abuse Mental Health Services Administration, 84% of individuals who experience a substance use disorder also experience a co-occurring mental health issue as well. During times of stress, many of us will seek relief in any way that we can find it. The use of substances, though, is not a healthy way of coping. Substance use is frequently used as a means to escape or to numb out from life's problems. Substance use will often exacerbate a previous existing problem, making it worse. In cities across the country, people are increasingly living under shelter-in-place or lockdown mandates that have closed businesses, limited social gatherings, and urged self-quarantine. These added stressors have resulted in increased levels of alcohol consumption. According to the Republic National Distributing Company, a wine and spirits distribution company, sales of spirits have jumped 50% for the week ending March 21st, 2020. Nationally, the overall increase for the week, according to Nielsen data, saw a 55% spike in alcohol sales. Now, each of us experience stress from time to time. However, recent events of the past few months have been unprecedented. Stress can feel overwhelming. There are different types of stress, all of which carry physical and mental health risks. A stressor may be a one-time or a short-term occurrence, or can happen repeatedly over a long period of time. Some people may cope with stress more effectively and recover from stressful events more quickly than others. Unfortunately, for some, substance use becomes an unhealthy way to self-medicate one's stress, one's mood, and/or anxiety. Coping with the impact of chronic stress can be challenging because the source of long-term stress is more constant than acute stress. The body never really receives a clear signal to return to normal functioning. With chronic stress, those same life-saving reactions in the body can disturb the immune, digestive, cardiovascular, sleep, and reproductive systems. Some people may experience mainly digestive symptoms, while others may have headaches, sleeplessness, sadness, anger, or irritability. When does one's consumption of a substance become problematic? Now, a substance can be alcohol, can be drugs, can be gambling, can be the internet, can be gaming. Addictive behaviors consist of the following three behavioral questions, known as the 3 C's. Is there a loss of control? Am I able to still manage this behavior? Number 2, is the behavior compulsive? That I'm not able to stop the behavior. And number 3, probably the most important of the 3, do I continue to engage in the behavior despite the negative consequences? Coping with life stressors by the use of alcohol or any other substance is a bad idea. If you take practical steps to manage your stress, you may reduce the risk of negative mental and physical health effects. Rather than reaching for that adult beverage, here are some tips that might be helpful in coping with stress. Be observant. Recognize the signs of your body's response to stress, such as increased alcohol and other substance use, difficulty sleeping, being easily angered, feeling depressed, having low energy. Talk to a health professional. Don't wait for your health care provider to ask about your stress. Start the conversation and get proper health care for existing or new health problems. Effective treatments can help if your stress is affecting relationships or your ability to work. Get regular exercise. Just 30 minutes per day of walking can help boost your mood and improve your health. Pursue calming activities. Explore relaxation or wellness programs, which may incorporate meditation, imagery, muscle relaxation, or breathing exercises. Schedule regular times for these and other healthy and relaxing activities. Set goals and priorities. Decide what must get done now and what can wait. Learn to say no to new tasks if you start to feel like you are taking on too much. Try to be mindful of what you have accomplished at the end of the day, not what you have been unable to do so. And then finally, stay connected. Even though this may be a challenge given our current social distancing, we need to remain connected with one another. You are not alone. Keep in touch with people who can provide emotional support and practical help. To reduce stress, ask for help from friends, family, one's community, one's religious organizations. Many community support groups like AA or NA or Gamblers Anonymous or Smart Recovery are available online. Stay healthy and stay connected. I'm Dr. Chris Tuell.